Scott, with the outbreak at the ACI, people have been calling for lowering the population at the ACI to deal with it. Dr. Jennifer Clark, who is the outgoing medical director, said that efforts to reduce the prison population should be underway. What are your opinions on that?
We are aware of those thoughts. With the transition of the medical director care at the Department of Corrections, the Rhode Island Department of Health has been working closely to help ensure what's needed to quell the outbreak there has been taking place. We meet regularly throughout the week. We support the Department of Corrections in the approaches that are taken to help minimize risk of spread. And they know which units it's acceptable to perhaps think through those practices and which are not. So our focus is to support the Department of Corrections leadership, help ensure that there isn't any increase in spread, and make sure that our inmates and staff remain protected.
Right now, the DOC only updates the public at most once a week on Facebook. As part of the web update you just mentioned, could this be done more often so that people would have a better idea of what's going on?
You always also, as the press, have the opportunity to reach out to the Department of Health and the Department of Corrections. We can provide information as needed.
From people in the community, family members and such.
Yeah.
Has anyone died at the ACI from COVID that we know? Because we're not hearing those numbers either. And there's a lot of rumors coming out that people are dying. I'm hearing bodies dropping. So I'm wondering if anybody's actually died, if we know of that yet.
That rumor is not a correct one. We're working closely with corrections. We do not have scenarios such as that.
And lastly, a medical professional suggested that giving the incarcerated more time outside where spread is lower, perhaps using the National Guard to help with supervising more yard time might be a good idea. Right now we're keeping them cramped up in small confinement where spread is high, but if we got them outside more, maybe that would help. What do you think of that?
Thank you for that. We are applying all measures that are effective and able to be applied within corrections.
And lastly, Governor, do you have any opinions on using your authority to lower the prison population? I've been told that under Rhode Island General Laws 425618, you have the power to modify the criteria for reclassification and to temporarily grant parole, including medical parole or temporary furlough.
Yeah. So first of all, I like the ideas that you said before, and I'll look into both of them, both in terms of using the guard as well as the transparency. A few thoughts. I do not have that authority. I'm quite certain of that. Also, I think it's important to recognize that we're dealing with max security here. So earlier in the pandemic, I did work with the courts. The courts have the ability that you speak of to encourage the early release of a small number of low-level offenders who were within, I can't remember, 30 or 60 days of release anyway. This is different, that these are, in some cases, violent offenders, much more serious crimes. Having said that, the courts have that power, not I, and I don't think, given the circumstances of what we're dealing with right now, it would be appropriate.